Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, welcome back, and today we have heard from Justin Trudeau, and he's talking about there'll be a flight this weekend that will actually get out there and it's flying to Morocco to help bring back Canadians that were stuck abroad. He's making every effort that he can with negotiating with the airlines, Canadian Airlines, to actually bring Canadian citizens back home, where they can be safe here in Canada, away from hotspots with the virus. So, also he talked about different businesses across Canada that have wanted to step up to the plate and offer services, manufacturing of goods, things like that, to be distributed to help ease the strain of social distancing and measures that have been put in place to help keep us safe from COVID-19. So let's listen to that, and here we go.
Government measures today.
Bonjour tout le monde. Before
I begin today's announcement, I want to say a few words about travel. We are currently in discussion with Canadian Airlines to help Canadians to come back home. We will have more details to announce, but I can tell you that the first flight will leave Morocco over the weekend. As I announced on Wednesday, Canada and the United States have concluded an agreement to prevent non-essential travel, particularly tourists. Trade will, however, continue. This measure will come into effect at midnight tonight. Minister Blair will provide more information on this later today. Furthermore, Canada and the United States are announcing a mutual agreement under which we will now send back irregular migrants trying to cross the border.
We're in discussion with Canadian Airlines to help Canadians stranded abroad come home. We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend. As I announced Wednesday, Canada and the United States have agreed to stop non-essential travel, specifically for tourism and recreation. Trade and commerce will continue. This takes effect at midnight tonight, and Minister Blair will give more details today. Further, today, Canada and the United States are announcing a reciprocal arrangement where we will now be returning irregular migrants who attempt to cross anywhere at the Canada-US border.
Over the last week, the entire country has mobilized to slow down the spread of COVID-19. Doctors and nurses in retirement have come in to help in the hospitals. And people administering the screening tests and researchers looking for a solution always are working longer hours. The important thing is that people follow the instructions from our public health officials. Frequent hand washing, working from home, limiting travel in order to protect our health and the health of others. But it's not only individuals who want to help their communities. Businesses as well are stepping up. I think, for example, of grocery stores that are opening an hour earlier to serve the most vulnerable Canadians, or manufacturing companies that are asking what they can do to help. Just last week, a number of companies right across the country contacted our government to offer their assistance. I want to thank them for their solidarity and their generosity.
This week, many businesses put their hand up and asked us what they can do. So today we're announcing a new strategy that will make it easier for companies to help out during this critical time. We are launching Canada's plan to mobilize industry to fight COVID-19 to ensure that we can quickly produce here in Canada the things we need. This initiative will help companies that are already making things like masks, ventilators, and hand sanitizer to massively scale up production. It will also provide support to those who want to retool their manufacturing facilities to contribute to this fight. For example, the Auto Parts Manufacturers Association reached out to us asking how they could help. Our healthcare professionals really need support, so our government will help these companies shift production from auto parts to medical supplies. We're also closing to reach agreements with several other companies, including Thornhill Medical, Medicom, and Spartan Bioscience. Minister Baines and Minister Anand will have more to say on this later today. Our government is also creating new, innovative procurement streams to allow more businesses to develop solutions and products Canadians need because of COVID-19. We will expedite these streams so firms can get to work quickly and these products are ready to use as soon as possible. Canada is home to some of the best innovators in the world, and with this new initiative, we will harness their talent and know-how to get through these challenging times. Aujourd'hui,
Today, we are launching a plan to mobilize industry to fight COVID-19 so that we can rapidly produce the articles we need here in Canada. Through this plan, companies that are already producing respirators and masks and hand sanitizer will be able to considerably scale up their production. We will also be supporting those that need to buy equipment to allow their plants to produce the articles now in demand. For example, the Auto Parts Manufacturing Association has reached out to us to see how it can help. Our healthcare professionals really need our support, and therefore our government will help those companies to produce medical equipment rather than auto parts. We are also reaching agreements with a number of other companies, including Thornhill Medical, Medicom, and Spartan Bioscience. Ministers Baines and Anand will have more to say about that later today. Our government will also be introducing new innovative procurement streams in order to allow a larger number of businesses to develop solutions and products that Canadians need because of COVID-19. We will quickly be expediting this new process so that companies can get down to work as soon as possible. Canadian innovators are among the best in the world, and with this new strategy, we are putting in practice and using their talents and their knowledge in order to help us come through this difficult time together.
Over the past week, Service Canada and many government agencies have received a historic number of calls from concerned Canadians. We received over 500,000 applications so far this week, compared to just under 27,000 applications for the same week last year. I know people are anxious to get the help they deserve, and our government is working as fast as possible to support them. This is, of course, an unprecedented situation, and it's putting a lot of pressure on our system, but we're on it. Thousands of public servants are working around the clock to help you. I know this past week has been hard on people for many reasons. Working from home while the kids are running around, not being able to visit your parents at their nursing home, not hanging out with your friends. It can take its toll. But it is in these challenging times that we also see what we're made of. This past week, no matter how difficult, was further proof that Canadians are generous, kind, and compassionate, and that should give us all hope. We all understand our responsibility as Canadians. We have to do the right thing, whether it's working from home or practicing social distancing, to protect our nurses, doctors, and everyone who works in our healthcare system. To deal with this crisis, we need everyone, citizens, businesses, and governments, to come together and do their part. That's what we've seen right across the country. I want to thank all the workers who are stepping up and all the companies who are making things our country needs. If you own a business and you're wondering what you can do, reach out. We need your help. Canadians need your help. And our government is ready to work with you to maximize your impact. I will end this morning by addressing all those celebrating Nowruz today and this past week. This is usually a time when friends and families gather around the half-seen table and share a festive meal, but this year is a bit different. To the many families who've been spending their first Nowruz without loved ones lost in the Ukraine International Airlines tragedy, know that all Canadians mourn with you. I also know that many have had to postpone festivities because of COVID-19, and I want to thank you for that as well. Social distancing is crucial in limiting the spread of the virus, and we do this now. Soon we will be able to celebrate together. In the meantime, I want to wish you all a very happy New Year, Nowruz Etan Piruz, and I look forward to marking the occasion with you again in the future.
Okay, so a lot of the social distancing measures and closing of public areas and things like that they were first designed and talked about through the World Health Organization. And we have Dr. Tedros today from the World Health Organization. He's going to give a update to us from to the world, and he has some good news, some hopeful news from out of Wuhan, where they are reported no new cases of COVID-19 overnight. This means that measures are working there. Things that they are doing in Wuhan are actually working, and as the numbers have come to no new cases, it means that also that the doctors can concentrate on healing the cases only the cases that are there in front of them, knowing that there isn't a strong pouring of new cases coming at them. So let's listen to what Dr. Tedros has to say, and here we go.
Thank you, Margaret. Good morning, good afternoon, and good evening, wherever you are. Every day, COVID-19 seems to reach a new and tragic milestone. More than 210,000 cases have now been reported to WHO, and more than 9,000 people have lost their lives. Every loss of life is a tragedy. It's also motivation to double down and do everything we can to stop transmission and save lives. Of course, we have good news today. Yesterday, Wuhan reported no new cases for the first time since the outbreak started. Wuhan provides hope for the rest of the world that even the most severe situation can be turned around. Of course, we must exercise caution. The situation can reverse, but the experience of cities and countries that have pushed back this virus give hope and courage to the rest of the world. Every day, we are learning more about this virus and the disease it causes. One of the things we're learning is that although older people are the hardest hit, younger people are not spared. Data from many countries clearly show that people under 50 make up a significant proportion of patients requiring hospitalization. Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I'm grateful that so many young people are spreading the word and not the virus. As I keep saying, solidarity is the key to defeating COVID-19. Solidarity between countries, but also between age groups. Thank you for heeding our call for solidarity, solidarity, solidarity. We have said from the beginning that our greatest concern is the impact this virus could have if it gains a foothold in countries with weaker health systems or with vulnerable populations. That concern has now become very real and urgent. We know that if this disease takes hold in these countries, there could be significant sickness and loss of life. But that's not inevitable. Unlike any pandemic in history, we have the power to change the way this goes. WHO is working actively to support all countries, and especially those that need our support the most. As you know, the collapse of the market for personal protective equipment has created extreme difficulties in ensuring health workers have access to the equipment they need to do their jobs safely and effectively. This is an area of key concern for us. We have now identified some producers in China who have agreed to supply WHO. We are currently finalizing the arrangements and coordinating shipments so we can refill our warehouse to ship PPE to whomever needs it most. Our aim is to build a pipeline to ensure continuity of supply with support from our partners, governments, and the private sector. I'm grateful to Jack Ma and his foundation, as well as Aliko Dangote, for their willingness to help provide essential supplies to countries in need. To support our call to test every suspected case, we're also working hard to increase the global supply of diagnostic kits. There are many companies globally that produce diagnostic kits, but WHO can only buy or recommend kits that have been evaluated independently to ensure their quality. So we have worked with FIND, the Foundation for Innovative New Diagnostics, to contract additional labs to evaluate new diagnostics. In parallel, we're working with companies to secure the supply and equitable distribution of these tests. And we're also working with companies to increase production of the other products needed to perform the tests, from the swabs used to take samples to the large machines needed to process them. We're very grateful for the way the private sector has stepped up to lend its support to the global response. Just in the past few days, I have spoken with the International Chamber of Commerce, with many CEOs through the World Economic Forum, and with the B20 group of business leaders from the G20 countries. We understand the heavy financial toll this pandemic is taking on businesses and the global economy. We're encouraged by the solidarity and generosity of business leaders to use their resources, experience, and networks to improve the availability of supplies, communicate reliable information, and protect their staff and customers. And we're also encouraged that countries around the world continue to support the global response. We thank Kuwait for its contribution of $40 million. In addition to increasing access to masks, gloves, gowns, and tests, we're also increasing access to the evidence-based technical guidance countries and health workers need to save lives. WHO has published guidelines for health ministers, health system administrators, and other decision makers to help them provide life-saving treatment as health systems are challenged without compromising the safety of health workers. The guidelines detail actions all countries can take to provide care for patients, regardless of how many cases they have. They also outline specific actions to prepare health systems according to each of the 4 Cs: no cases, sporadic cases, clusters of cases, and community transmission. These guidelines provide a wealth of practical information on screening and triage, referral, staff supplies, standard of care, community engagement, and more. We encourage all countries to use this and many other guidelines, which are all available on the WHO website. But we're not only advising countries, we also have advice for individuals around the world, especially those who are now adjusting to a new reality. We know that for many people, life is changing dramatically. My family is no different. My daughter is now taking her classes online from home because her school is closed. During this difficult time, it's important to continue looking after your physical and mental health. This will not only help you in the long term, it will also help you fight COVID if you get it. First, eat a healthy and nutritious diet, which helps your immune system to function properly. Second, limit your alcohol consumption and avoid sugary drinks. Third, don't smoke. Smoking can increase your risk of developing severe disease if you become infected with COVID-19. Fourth, exercise. WHO recommends 30 minutes of physical activity a day for adults and 1 hour a day for children. If your local or national guidelines allow it, go outside for a walk, a run or a ride, and keep a safe distance from others. If you can't leave the house, find an exercise video online, dance to music, do some yoga, or walk up and down the stairs. If you're working at home, make sure you don't sit in the same position for long periods. Get up and take a 3-minute break every 30 minutes. We will be providing more advice on how to stay healthy at home in the coming days and weeks. Fifth, look after your mental health. It's normal to feel stressed, confused, and scared during a crisis. Talking to people you know and trust can help. Supporting other people in your community can help you as much as it does them. Check on neighbors, family, and friends. Compassion is a medicine. Listen to music, read a book, or play a game. And try not to read or watch too much news if it makes you anxious. Get your information from reliable sources once or twice a day. To increase access to reliable information, WHO has worked with WhatsApp and Facebook to launch a new WHO Health Alert messaging service. This service will provide the latest news and information on COVID-19, including details on symptoms and how to protect yourself. The Health Alert service is now available in English and will be introduced in other languages next week. To access it, send the word HI to the following number on WhatsApp: 0041 798 931 892. We will make this information on our website later today. COVID-19 is taking so much from us, but it's also giving us something special, the opportunity to come together as one humanity, to work together, to learn together, to grow together. I thank you.
Okay, we have an update from Adrian Dix and Bonnie Henry. As you know, Dr. Henry has been reporting to us on how measures are going here in British Columbia, and what measures are actually been working, and what we need to actually improve on to actually keep us safe and bring the numbers and our curve down so that it doesn't strain our healthcare system. So she does have a report that there was a new case reported within a senior care facility, and of course our hearts all go out with to those families of those who have come out with the infection, and for those who have actually passed away from it. So let's hear what Adrian Dix and Dr. Bonnie Henry have to say.
Good afternoon. I'm Adrian Dix, BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer for British Columbia. I just want to let members of the media and the public know that we will be doing a briefing tomorrow, Saturday. It'll be here and it'll be at noon. We want to acknowledge the territories of the Musqueam, the Squamish, and the Tsleil-Waututh, where we're giving this briefing today, and I wanted to introduce our Provincial Health Officer, Dr. Bonnie Henry.
Thank you, and good afternoon. So today we are announcing that we have 77 new cases tested here in British Columbia for a total of 348 people. This includes 200 in Vancouver Coastal Health, 95 in the Fraser Health Region, 30 in Vancouver Island, 19 in the Interior Health Region, and 4 in the Northern Health Region. Of those, 22 people have been hospitalized, are in hospital at the moment. 10 of those people are in ICU, and 6 have now recovered fully from this disease. I did want to talk as well. We have a couple of long-term care facility outbreaks, including in our numbers a new healthcare worker is identified associated with the Dufferin Care Centre, and that centre is now being managed as an outbreak, as we do whenever we detect a case in a healthcare facility. So Fraser Health is addressing that issue today. In talking about healthcare workers, I think that is something that is always in the back of our minds as we've been going through this last number of weeks. And I do want to say that we have had a number of healthcare workers who have been infected with this virus. And today I really want to talk about my colleagues. I know how challenging it is when we are dealing with a new virus, a virus particularly for which we have no cure, we have no vaccine, we have no way of preventing it. And we know that it can cause quite severe illness in people that we love and people that we care for and people that we're close to. And it's been a tremendous challenge for our healthcare sector to watch what has been happening over this last few weeks and months around the world. And I have been watching with them very, very carefully and looking at what are the things that we need to do to best protect our healthcare workers and our healthcare sector here. And I want and so much, of course, in the beginning is very unclear. But I do want to say we do know so much more now about this virus here, and we know that hundreds of people have been safely cared for by our healthcare worker teams here in Vancouver, here in BC, here in Canada over the last few months. And we know that they're safely cared for because of the dedication and the intense practice that we have in our healthcare workers system. We know as well that about 24 of our healthcare workers here in British Columbia have been affected with this virus. And I'm relieved and happy to say that none of them have had severe illness. All of them have had very mild illness, and there have been some very short hospitalizations, but for the most part, people have been managed at home, and that is something that we're grateful for. It is everything that we do in the healthcare setting that keeps us safe from this virus. And these are things that I've talked with my colleagues many times over the last number of weeks. It's identifying cases early, and we've seen that around the world. It's when we have unrecognized cases that are in a hospital or in a care home that it gets transmitted. And that's when people can get sick, and that's when it gets passed on to others. It's making sure that we have administrative processes in place so we minimize the people that are in contact with somebody who's sick. We make sure that as soon as you go into the hospital, and we talk about this a lot, about the importance of calling ahead, and as soon as you go in with respiratory symptoms, you're given a mask to prevent you from putting your droplets out there, prevent other people from being exposed. It's the engineering things, like putting someone in a single room, like making sure we have the right air exchanges in our hospitals and our settings. And of course, it's the personal protective equipment that healthcare workers wear that protect them as well. And I know there's been a lot of angst and a lot of concern that we're not going to have the supplies that we need to best protect our healthcare workers across the spectrum, whether it's in the pre-hospital care, in home care, whether it's our community physicians, whether it's our hospitals or our long-term care homes. And I want to say that right now we have been working on this across the province and across the country, and we do have the supplies that we need right now. And we are committed to doing everything that we can to make sure that we continue to have what we need to best protect everybody in our healthcare system right now. And that's my personal commitment as well. Finally, I do want to say a little bit about the fact that we have had these social distancing measures in place. We've had gatherings that have to be curtailed, but we do need to make sure that we still have the resources that are available to support us. We need businesses to support our healthcare workers in particular, make sure we have food, make sure we have childcare, and details around our childcare strategy to support our essential workers will be coming out very shortly. But we also need to make sure that there's appropriate precautions that are taken in certain settings to make sure that we are not allowing settings that allow transmission of this virus. And we go back to the reasons that we're doing this. The reason that we're doing this is so that we can build a firewall. We can prevent transmission of this virus between us so that we can prevent the people that are the most susceptible to having severe illness or dying from this disease from being exposed to it in the first place. And that's the reason why we're doing all of these very extreme measures in many places. And it's become clear to me that there are certain settings where this is really a challenge. And we talked earlier about restaurants, and we put in some guidance around being able to maintain a distance within the restaurant. And it is becoming obvious, as it has to many of the municipalities around here, that this is a very challenging thing to do. So from today, my order is that restaurants must move to a take-out or delivery model only as a way to best protect us and to ensure that we can maintain those distances. I also say that, for many businesses, they can and should stay open to support us, but they need to have the important social distancing measures in place to ensure there's not that many people in the office environment, for example. There's not face-to-face meetings. There's not congregation in groups. It's also important, and I've talked about this, for us to go outside. But like we do when we're inside, we need to go outside with our close family, with our small groups. We're not to be outside in groups. We're not to be out playing basketball. We're not to be out sitting together in large groups on the beach, watching the beautiful sunsets that we have. Because when we're out in groups like that, the chances are that somebody will be exposed to this virus, and then we'll bring it home to our family and our communities, and that is what is going to spread the virus. So right now, And again, this is not forever, but right now we need to be in small groups. We need to be with our family. We need to be with our close friends, one or two of us. And we need to maintain our distance with others. We must be united in these efforts, and we need to build that firewall and make sure that we keep it as strong as we can and that there are no gaps.
Thank you very much, Dr. Henry, and I wanted to just lay out a couple of things that have changed and some new information that people have been asking for that I think people will be interested in. As Dr. Henry says, 77 new cases today for a total of 348 province-wide. To put that in context, 22 of those cases are in acute care. That's compared to in hospital, compared to 17 yesterday, and 10 are in ICU, compared to 9 yesterday. And I just want to put in context for a moment. 2 weeks ago, the Premier and Dr. Henry and I laid out our pandemic preparedness plan. We had been at stage 1 in dealing with acute care hospitals in terms of preparing them and opening up space. And this Monday we went to stage 2 with the cancellation of non-urgent elective surgery. I just want to briefly report out how significant these actions have been and what they've meant and what they mean in the system. Prior to the COVID-19 response, we averaged about 103.5% capacity in our acute care system. That capacity as of now, our snapshot as of today, is 78.5%. That's a change in occupancy in a very short period, in particular this week, of 25%, or 2,398 beds. In addition, our critical care beds are at 61.8% capacity. And I just want to put this in context because there's a lot of discussion of what people are doing in terms of preparing. But I think in terms of preparedness, as I just said, 22 patients currently in acute care. Just to put it in context, this preparedness is not what happened in other jurisdictions, and this shows how much we've learned from other jurisdictions. We've acted, and our actions have had consequences for a lot of people, as you can see in these bed numbers. But we've acted now to ensure that our acute care sector, that our hospitals are more prepared for a possible surge or influx of patients. And this has required extraordinary effort by everyone in the acute care sector, and I wish to thank them. We released and published this morning, I believe, on the BC CDC website, the testing numbers for this week, which I believe are 17,912. I want to echo what Dr. Henry said about the healthcare sector, about healthcare workers, that we must do everything possible to support our frontline workers in hospitals, long-term care, the entire healthcare sector, to give them confidence that they can do their jobs with the lowest possible risk of their health and well-being. Frontline staff are critical to beating this virus. They are critical to beating this virus. I know all British Columbians support this goal, and I want to say this directly to doctors, to nurses, to care aides, to those who keep our hospitals clean and safe, to food support workers and everyone else on the front line. We are grateful. We are enormously grateful for all your efforts. We're making headway together against this threat, but we're far from prevailing. Everybody knows that. But we also know, Dr. Henry has said it, that you're performing miracles every day. I want to make it as clear as I can. We're going to spare no effort to ensure that you have the equipment you need to get the job done, including the equipment to keep you safe. We do have supplies in place, and we're identifying more. We will, of course, respect your collective agreements and do what it takes to provide the additional support, childcare, and extra accommodation to help you work effectively. We'll track down and punish anyone caught misappropriating, the better word is stealing, the supplies we need for your protection. But our healthcare system doesn't exist in a vacuum. It needs support from every part of society and every part of the economy, and those essential services must continue. They cannot be shut down. They're equally critical to beating this virus. Of course, we know, and we've said it, and everybody understands how important care aides and nurses and doctors are. But so are pilots flying test kits to labs, early education workers caring for our health workers' kids, grocery workers making sure we're all fed, and longshoremen moving critical supplies across the dock. We are grateful for your work, too. It must continue under safe conditions, and we're taking additional steps to clarify the conditions under which important work can continue, both in healthcare and the wider economy. We'll have more to say on this shortly, but we'll be calling on employers, unions, and WorkSafe to develop the protocols under the supervision of Dr. Henry to give those working in the economy the confidence they are doing so safely. Of course, in addition to this, and Dr. Henry has made it clear with respect to restaurants, and I've had occasion to talk to a number of mayors, including the mayor of Vancouver today, clarity about restaurants and the fact that they can only operate on their takeout basis. I want to say this, there's lots of discussion about all of the group of people that may not be following Dr. Henry's orders. It's our expectation that we all do so. It's what we owe to one another, and we must continue to do that. I want to say a couple of extra things. Yesterday, we convened Isabel McKenzie, the seniors advocate, staff of the Ministry of Health, and MLAs from all parties, including Shirley Bunn and John Yap, who are Liberal members, including Honoré Leonard and Janet Rutledge, who are NDP members, and Sonia Furstenau, the Green Party House Leader, to work together to build on a groundswell of community goodwill that is out there to support seniors. They've come back and reported with recommendations that working and using in alliance with Better at Home and the United Way to make to support seniors who are currently dealing with the consequences of social isolation necessary to protect their health. We'll have more to say about this on Monday, but I want to thank all the members of that committee and the actions that they have recommended are being put into motion. Finally, I just want to say we are all in this together, and today we're going to find more ways to be all in the fight, and tomorrow we're going to find more, and we need everyone to join us. We've said it before, but we need to say it again and again and again, not just in settings like this, but to one another, that we know, because Dr. Henry has laid it out, some of the toughest measures anyone has seen that are required for all of us to keep each other safe. Some of it is simple: soap and sleeve and social distance and self-isolate and stay home when you're sick and support seniors and elders and those who are vulnerable. But starting now, there's no longer any room for almost or pretty good or nearly enough. Starting now, our individual fight, our collective fight must be 100% all of the time and 100% of the effort and 100% right. I know it's a lot to ask of a lot of people. I know people don't get the information all at the same time. But we need to give our healthcare workers, our healthcare professionals, Dr. Henry, our whole team of people around the province who are preparing to deal with the health consequences of this virus. We need to give them the flattened curve they need to provide the continued service and the continued care that will help everyone in the province. Right now and every moment from here on, going all in on COVID-19 will save lives and our own lives and those of the ones we love. It's just that simple. Nous annonçons 77 nouveaux cas de COVID-19 aujourd'hui, pour un total de 348 cas en Colombie-Britannique. Parmi les nouveaux cas, un réside au Dufferin Care Center, un établissement de soins de longue durée à Coquitlam. Les équipes de santé publique et de contrôle des infections à la régie de santé de Fraser sont sur place. Chaque régie de santé en Colombie-Britannique compte maintenant des patients atteints de COVID-19. 200 sont dans la régie de santé de Vancouver Coastal, 95 à Fraser, 30 sur l'île de Vancouver, 19 à l'intérieur et 4 au nord. De plus, sur le total des cas de COVID-19, 22 personnes sont actuellement hospitalisées, 10 sont en soins intensifs et les autres patients sont à domicile isolé. We're ready to take your questions.
Thank you, Minister.
Okay, so number of cases to date, according to this would be for Canada, is British Columbia is at 271 cases, Alberta 146, 8 cases for Saskatchewan, Manitoba is 17, Ontario 308, 121 cases for Quebec, Newfoundland and Labrador has a case. New Brunswick is 7. Nova Scotia is 5. 2 for PEI. And our total across Canada is 898 total cases. And we've had a total in Canada, a total of 12 deaths due to COVID-19. In comparison to the global cases, are total global cases are 274,643. Total deaths are 11,366, leaving recovered cases 90,942 people who have recovered from COVID-19, leaving us with a recovery rate of 89%. So there we have it for the numbers for today. And next up, we would get to our uplifting story. Somebody sent me a message today, and I'm going to read that to you next. Today I received a Facebook message from Kimberly Burge, and the message reads like this. My husband and I have dropped off a letter to our fellow strata owners, offering ourselves for service, helping to pick up medicine, us picking up groceries and delivering. We live in a 108 strata lot, with 70% of the owners being over 60. Many have families that isn't local. Today I printed a document for one of the owners that is younger. That they want to post around their home, and they have someone living in the home with a compromised immune system. So thank you, Kimberly, for sending us this message. It is great that you're getting out there and you're helping people in your strata with groceries, medication, and whatever it was that this printed document was needed to help protect somebody else with a compromised immune system. This is great work, and the kind of stories that we want to post at the end of these updates, so that people know that, hey, we're all here together for each other. We're all in a loving, caring environment, even though we are told by the doctors and healthcare workers and officials to kind of separate from each other and avoid social contact, or social physical contact, should I say. And we need these stories like that so that we know that, hey, there are people out there just willing to help, and that we're all in this together. Okay, thank you again for listening, and we will talk to you next time. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.